Thank you all for coming. We are very excited to have this webinar specifically on talking about Nox technology and our new line of products from AOR called Axioma. Okay, so as Susan mentioned, we will be going through the material, the background, kind of what caused the genesis or the start of this line of products. And we're going to kind of go through the background of what exactly nitric oxide does, why it's beneficial to the body, what's the physiological process. And I think it's important to understand these concepts before we move into actually discussing each specific clinical formulation. And we will discuss all 6 of the formulations that are in the Axioma line at present. Also, a really great resource that you were sent out is this Advances catalog, our magazine that is sent out. And the latest one is on Nox technology. It's an excellent resource for you to turn to if you have any other concerns or questions, or just another way of going over this. Okay, so here's just this slide's talking about the kind of topics of discussion. So the basics and the background of nitric oxide I already mentioned. Then we're going to talk a little bit about the safety of nitrates and this Nox technology, and then we're going to talk about the specific formulations. And then we're very, very excited about launching this innovative product because it's on the cutting edge of research, and there's a lot of clinical evidence that is now mounting behind and supporting Axioma. So we're very excited. So let's get right into it. Okay, so let's talk about the importance of nitric oxide first. I'm sure all of you have heard of nitric oxide before and its benefits specifically related to governing how closed or wide open blood vessels are. And that's, as you can see here, the last point is that nitric oxide has been most commonly referred as the endothelial-derived relaxation factor, which is responsible for regulating blood vessels. But actually, nitric oxide its role is much larger than just that. It's primarily a communication molecule, and we'll talk about this as slides go on specifically, but it's a molecule that allows the body's cells to communicate between each other, whether it's the immune system or neurological system. So it has a wide range of effects. Because it's a communication molecule, it is a very powerful effector molecule, which basically means that it makes things happen in the body. And often in disease processes, things aren't happening well, and we need to impact that. And that's exactly what Axioma's target is that we are trying to impact specific disease processes and find health benefit. Okay, so let's go over some of the functions of nitric oxide in the body. Nitric oxide, as I mentioned, most commonly known as its role in vasodilation. So things like blood pressure would be here. Cell signaling, as I mentioned, it's a very powerful signaling molecule, communicating between cells, sending messages in the body. Neurotransmission, another form of communication, a very important form. Nitric oxide also plays a role in the communication between nerve cells. Immune function. Immune function is very, very important for a number of reasons. Obviously, protecting us from processes like cancer. Our immune system is very important for that. And of course, protecting us from general invasions of microbes, bacteria, and viruses. And nitric oxide plays a key role in communication between immune cells, but also in the destruction of invaders. And lastly, the points that we're going to highlight here, it's definitely not just limited to these points. We just kind of highlighted the top 5, but nitric oxide has many, many other roles, as we'll see going on. But GI function is the last one we're going to talk about here. Nitric oxide is essential as a signaling molecule in the stomach mucosa and the GI tract. And what it basically does is that it increases blood flow to those areas, and you can see how that might be beneficial in terms of protecting the lining as a clinical application. So those are some of the functions of just nitric oxide in the body. So obviously, you can see that the influence of nitric oxide on health is very wide-ranging. So nitric oxide has been used in erectile dysfunction, blood pressure, as we know. It's been tried to influence to actually have impact on these processes. But not just that. Kidney health, that's very much related to cardiovascular function. stomach and GI health, brain and nerve health. A lot of actually, a fair bit of research has shown benefit for exercise and endurance as well. So you can see, without going into all of these, and this, again, this list is not exhaustive, you can see how there's a wide range of effects that nitric oxide has on the body. It's a very, very powerful effector and communication molecule. So here's the problem with nitric oxide. As powerful as nitric oxide is, and as essential as it is, it's actually a very unstable molecule. When nitric oxide is formed in the body, it only sticks around for about 1 to 2 milliseconds, which is a very, very short period of time. It does what it needs to do, but then again, if it doesn't get used up, it gets decomposed, and it no longer is functional. So obviously, we've established how essential this is to so many bodily functions. It obviously needs to be constantly produced, and the system needs to be reliable. That in all aspects, in all environments, internally and externally, nitric oxide is able to be produced. And so we're going to talk a little bit about how this is going to be produced. And this is going to lead into and kind of pave the way and pave the background of how Axioma works and how the NOx technology works. So nitric oxide production, as we determined, nitric oxide is very essential. The classical pathway that we are all, in one way or another, familiar with is the arginine pathway. This is the classical pathway of nitric oxide production. And basically, you've seen supplements of L-arginine, and they've been touted to boost nitric oxide function, which is true. L-arginine, in combination with a number of enzymes, the nitric oxide synthase class of enzymes, and there's a number of different variations of those enzymes, they convert L-arginine to nitric oxide so it can be used in the body. Now, as we know, L-arginine is supplemented for a number of clinical impacts or clinical endpoints: erectile dysfunction, cardiovascular function, exercise performance. But the trouble with this pathway is that we typically need a fair amount of L-arginine to produce enough nitric oxide to have a clinical effect. And here's one that I really want to highlight, is that these nitric oxide synthases, they're essential to this process. They only function, and they function most optimally in environments in the body, in the cellular environment, at high oxygen and at high oxygen environments. So it's very dependent on the environment that it's in for these enzymes to function. So for a molecule that's so essential to the body, why would it have these? Why would the pathway of its formation have these almost roadblocks in it? Because I'm sure nitric oxide needs to be produced at all different environments in the body. So this is where scientists started to think. Nitric oxide is not just produced in high oxygen environments, obviously. Especially, you can think of a lot of disease processes that impair the ability for the body to get enough oxygen. So obviously, this is the question that they posed: so maybe there's another pathway, and what's the deal with a diet that's rich in fruits and vegetables? So this is really stemming back, if we go back to look at the birth in the research and in the evidence-based field of the NOx pathway. So researchers that were looking into diets that are rich in fruits and vegetables, they found them to be cardioprotective. And I think most people are familiar with, in one way or another, with the DASH diet. This stands for Dietary Approaches to Stop Hypertension. And this diet was come up by a group of medical doctors looking for a dietary approach to treat hypertension in a clinical setting. And they found that a diet that is high in fruits and vegetables, which is what the DASH diet is, low in saturated fats, and modest amounts of low fat dairy intake, was shown to be beneficial for cardiovascular function. Now, this has been proven in studies that this has a benefit on cardio function. However, the reason and the mechanism that a diet, specifically high in fruits and vegetables, has a positive impact on cardiovascular function, especially blood pressure, this mechanism is not exactly well understood. Now, we all know that a diet high in fruits and vegetables is beneficial for a number of reasons. So you can see there's minerals, vitamins, fiber, phytonutrients that all have an established beneficial effect on our health. But are they responsible for the cardiovascular benefits? Now, this is a question that researchers all over the world, but specifically in Sweden and England, have been focusing on. Now, they were looking at maybe the common denominator is not these phytonutrients and vitamins that are present in fruits and veggies, but actually another thing. Was it possible that nitrate content of vegetables may be responsible for this? So they went about to try to test this theory. So I'm using an example of Webb et al. This is a study done in 2008. It was published in an American Heart Association journal. And they asked the question, could the nitrate content of vegetables be responsible for the beneficial effect on cardiovascular health and on blood pressure specifically? So first of all, the question has to be, is this even possible? And if you look at the graph here on the right side of your screen, you can see that common vegetables such as bok choy, cabbage, they are actually quite rich in nitrates, in inorganic nitrates. These are naturally occurring nitrates, just like vitamins and minerals that are found in these vegetables. So they are present in vegetables, so it is possible. Now, maybe there's a pathway, they thought, of converting these nitrates in the body in terms of a reduction pathway all the way to nitric oxide through nitrite. So nitrate to nitrite to nitric oxide. So they did a study, and they basically supplemented with about 500 milliliters of beet juice. Beet juice is very rich in inorganic nitrates, as a lot of other vegetables are. And what they found is that when they measured the level of nitrates in the blood, that it actually went up 16 times after they supplemented this beet juice. And beet juice has about 250 milligrams of nitrate in it, so fairly rich, but not a huge dose. They also found that plasma nitrite doubled in the amount that was found in the blood. And most importantly, they found that blood pressure after 2.5 hours was decreased by 10 millimeters of mercury, both systolic and diastolic. Diastolic was reduced by 8 millimeters of mercury. And this effect lasted 24 hours. Now, from a science perspective, this is a very, very powerful effect. This is the DASH diet has about a 5 millimeter mercury decrease in blood pressure. And this was only after one dose of 500 milliliters of beet juice, a nitrate-rich vegetable. So this is a very, very important result. And here you can see in this graph, this is what really illustrates this point really, really well. You'll see that here the blue line is the nitrate content in the blood. And the red line here is the nitrite content. So after about 2.5 hours, 3 hours, the nitrates were elevated in the bloodstream. And then the nitrite followed right after. And that corresponded with the decrease in blood pressure you see here in the green line. So they found, and this is lending proof to the idea that, you know what, maybe L-arginine pathway is not the only way to produce nitric oxides. And this is really the birth of the NOx pathway. Now, I use this one study as a specific example, but there's been a number, and we'll touch on these a little bit further. There's been a number of studies that have shown the same effect, the same dose-dependent effect, which is actually really well described in this and shown in this graph. So the new discovery that this found was that actually nitric oxide can be produced from nitrates. So let's kind of go into how does this occur in the body, because this is very important to understand. Our body has been set up for this process already, as you can see here. So let's go through it just very, very visually. So first of all, we take a glass of beet juice or a serving, 100-gram serving of spinach or salad will have the same amount as 500 milliliters of beet juice. And the nitrates are absorbed. And this is the information from a number of studies to put together this pathway. And nitrates are absorbed in the GI tract. And then they're concentrated actually in the salivary glands in the mouth, of all places. And here on our tongue, as we know, we have probiotics, we have bacteria throughout our digestive tracts. And as we know, they're very beneficial to us in a lot of ways. And the no difference for the ones that actually, they start right up here in the oral cavity, right on the tongue. The bacteria on the tongue actually convert the nitrates that are concentrated in the salivary glands to nitrites. And then they're swallowed down in the saliva. And then in the stomach, in the high pH environment of our stomach acid, it's converted to nitric oxide. And then nitric oxide is absorbed. And then it actually gets converted back into nitrites and nitrates. Some nitrates are, the excess is excreted in the kidneys. So there's no evidence for any sort of overdose of nitrates. There's a natural process of excreting the nitrates. So this is where it gets right into the bloodstream. And now nitric oxide can be formed from nitrites and nitrates through a process of reduction. And this happens outside of the process of the L-arginine pathway that's dependent on these nitric oxide synthase enzymes. So that's the pathway in the body. So now, what are some of the advantages of this pathway? And this is really where this NOx pathway shines. First of all, as I mentioned, it's not slowed down by any enzymes in the body. Enzymes typically are the gatekeepers of any process. If an enzyme works slowly, and typically they don't work very quickly, the process it only goes as quickly as that enzyme works. So there's no enzyme in this process that's slowing down the production of nitric oxide from nitrates and nitrites. Second of all, nitrates are easily absorbed in the stomach. And we only need a small quantity of nitrates for beneficial effect. So the serving of 500 milliliters of beet juice has been shown to have a clinical impact, and also about 100 grams of salad or spinach, or any vegetable for that matter, but they've been using salad and spinach in the studies. So only a small amount has been shown needed to have a beneficial effect. Now, it actually has been shown to have a rapid effect, and that's what that study showed that I highlighted a few slides earlier. In less than 2.5 to 3 hours, the nitrate and nitrite levels rose in the blood, and the blood pressure decreased. And this benefit was preserved for about 24 hours. So that means you only need 1 dose per day to have that beneficial effect on blood pressure specifically. Next, there's no tolerance that's been found with inorganic nitrates, which are the nitrates that are found naturally occurring in fruits and vegetables. Now, the other common source of nitrates that we've heard, of course, is our angina medications, our nitroglycerin, the little blue pill that we take, that patients take when they are having chest pains, and it dilates the blood vessels in the heart, and they obviously stop having pains because the blood now can get to the muscle tissue of the heart. Now, when you take this medication over a period of time, eventually your body stops reacting to it, and you need to take a higher dose to have that same beneficial effect to relieve your angina pain. This tolerance effect is what that's called, is that there's been no evidence of this occurring when you take it through vegetable or inorganic nitrate supplementation. So this is a big benefit, because then we can only take it for a certain amount of time, and then we'd have to keep upping the dose. Next, the process this one's extremely key for us to remember as an advantage of the NOx pathway. The process is highly efficient in both high but especially low oxygen environments. And this is key because a lot of the pathologies, a lot of the disease and illness processes occurring in the body occur under low or impaired oxygen environments. So, for example, we can take ischemia or any sort of angina. Or we can take a diabetic neuropathy or impaired blood flow to a limb. These are all examples of impaired oxygen delivery to different body parts where we still could really benefit from nitric oxide, dilating blood vessels, performing its functions in the immune system, inflammation, and so on and so forth. So L-arginine pathway doesn't occur in low oxygen environments. So this has been kind of positioned as a backup backup system to the L-arginine pathway that will occur when we are in less than ideal circumstances, so in low oxygen environments. And the seventh point here is that there's a unique recycling pathway. I think we tend to think in a very linear fashion from nitrates, we go to nitrites and then nitric oxide. Now, this actually obviously does occur. And you can see how it's beneficial in the sense that nitric oxide is a very unstable molecule, only lasts about 1 to 2 milliseconds. But nitrites have a longer half-life. Now they're lasting 1 to 5 minutes. So they stick around the bloodstream a little bit longer. Nitrates, they actually have even a longer half-life. So this is one of the reasons why the researchers think that the effect lasts for 24 hours, is that actually nitrates and nitrites stick around longer and act as a source of nitric oxide for a long period of time, not that we need to be taking it every few minutes so we get the effect, the beneficial effect of nitric oxide, which is very short-lived. So these are 7 really key processes that are advantages to this new system, this new theory that's now being backed up by a lot of scientific evidence of generation of nitric oxide. So here's a really nice summary graph of what we just talked about. Nitric oxide produced under normal oxygen environment. So as of me and you, we're sitting here, we're using our L-arginine pathway to produce nitric oxide for functions in the body. This happens under normal oxygen conditions. Now, what if we go out and do some exercise? What if, for some reason, our limbs aren't getting enough blood flow, they're compromised by a disease process? This is now where this NOx pathway, the conversion of nitrates to nitrites to nitric oxide occurs, and this occurs in low oxygen environments. So this is very, very important for you can see the potential for treating diseases that have these specific environments. So this NOx technology, let's talk about that for a second. And the birth, now let's connect the science to actually the clinical application, which is Axioma. AOR, as we always like to pride ourselves, we pride ourselves as a very innovative company and really keep our eye on the latest research, and we always try to bring the most innovative products for our customers, our clients, and patients. And this is really understanding this line when researchers at AOR understood this new mechanism, there we saw tremendous potential in treating a lot of pathologies. And we'll get into some of the specific products, and you'll see the wide range of applications. So this is really where the birth of Axioma occurred, this line that's dedicated to this NOx technology. So it's using the therapeutic benefits of nitric oxide through the NOx pathway by the supplementations of inorganic nitrates. And we'll see this in the ingredients list. So are nitrates, are dietary nitrates beneficial? Based on the most current research, there's an unequivocal yes. It's been shown that green leafy vegetables have the highest level of nitrates. And these vegetables, interestingly enough, have the most research beneficial effects. So your dark greens, so your spinaches, your cabbage, your kale, these are ones that are actually have been considered for the longest time the most healthy. Diets that are rich in fruits and veggies, the DASH diet, the Mediterranean Japanese diets, these diets have been associated with the lowest rates of cardiovascular disease and generally the lowest rates of all-cause mortality. So maybe the one effect, the one mechanism this has is obviously a lot of all those other vitamins and nutrients, but nitrates now, they obviously have a lot higher intake of nitrates than other populations. These beneficial effects now can be attributed possibly to nitrates. Obviously, there's a lot more research that needs to be made before we can make an absolute ironclad connection, but now the theory is mounting for more beneficial effects from the nitrate content of these fruits and veggies. And as we all know, diets that are high in leafy green veggies have the lowest rates of cardiovascular disease. Vegetarians have the lowest rates of cardiovascular disease. And now the common factor, as I mentioned, is now coming to the forefront is nitrates. So what's the evidence for specific benefits of nitrate supplementation? So this is using nitrates in studies. They've been shown to lower blood pressure, It reduces the stickiness of blood. It reduces blood clotting, which is actually a target of a lot of drug or pharmacological interventions. There's decreased amount of stomach ulcerations in trials. It's been shown to be a liver protective. It's been shown to be have a positive effect on exercise performance, specifically on the oxygen consumption during exercise and also maximal exercise. So meaning we can actually go longer, and the participants in the studies got less tired and less quickly. An increase in blood flow in general. So any disease like sickle cell anemia, any disease that we have impaired blood flow, this would be beneficial for. And you can see so on and so forth. There's studies showing a number of benefits from a number of other things, as you'll see in a few slides. We'll put up some of these studies and we'll see them, but these are just a sampling of what the key most beneficial things would be. Here's that exact slide I was talking about. You can see, maybe this is a little small, but I think you can just appreciate, we're not going to talk about the detail, about each one of these studies is a clinical study that's been shown to have a positive effect. So for example, this one cardiovascular study used potassium nitrate, which is the form that AOR uses in the Axioma line. It's been done in humans, and it's been shown to decrease platelet aggregation, which means it decreases the stickiness of platelets, which decreases the risk or the chance of developing a blood clot. So you can see how beneficial this can be to someone that is trying to prevent a stroke or a heart attack. So this is just one slide. There's actually more studies than just this of beneficial clinical trials using nitrates. So the first thing that I think a lot of people think of is that are nitrates safe? That's the first reaction that we have. And that's because in our culture, especially in our medical culture, we have been kind of under the impression that nitrates and nitrites actually have a lot of negative effects on the body. From anything from cured meats, as you see here, they're an additive there, to high amounts in the water supply. So I think AOR understands this, that it's a concern for people, and that's why we are going to focus here on talking about it right now, to dispel any sort of myths that I think people have in their minds, because we need to take a look at the evidence and really determine if nitrates are safe. And I think after the next few slides, you'll see that they are definitely safe. So first thing people think of is nitrates in water. This is based on studies done in the 1950s that have been somehow showed that showed levels that were in well waters, nitrite levels in well waters, that showed there was actually a diminishment of oxygen capability taken in ability of kids of hemoglobin. And this has actually been now attributed to more bacteria rather than the nitrites. And high doses of nitrates and nitrites are used in medical settings all the time with no impact on oxygen ability and hemoglobin to carry oxygen. So this is actually very old, outdated data. It's been proved to be false and not true. Secondly, there's been no population or long-term studies that have found any link for nitrates to nitrites. Now, there's been some studies showing that this might be the possibility, or possibly trying to attribute that to nitrates or nitrites, and this actually has been shown to be also more based on speculation and rather than on good quality, solid evidence. And there are nitrates and nitrates used in cured meats, and this is because, as I mentioned before, nitrate or nitric oxide has a number of benefits in the body, and one of them is actually a potent antimicrobial, and this is why it's been added for years to cured meats. And now often people ask about what's the connection with gastric cancer. There's actually no definitive clinical evidence, no scientific evidence making this link. So this has more been based on a few opinions, medical opinions, again, kind of formulated in the past without any real solid data to back up the risk of nitrates and causing cancer. Now, the association with nitrates, sometimes nitrosamines, which is a derivative. Obviously, there's a nitrogen group. You see the nitro, a derivative of nitrates, that they're toxic and possibly carcinogenic. And actually, the antioxidants prevent the formation of N-nitrose or nitrosamine compounds. And that's why ascorbic acid and other antioxidants are added to meat to prevent this conversion. So obviously, diets that are high in fruits and vegetables have a high amount of these antioxidants, which prevent the formation of these potentially harmful compounds. And as you'll see in all of our Axioma products, we have green tea polyphenols antioxidants and vitamin C ascorbic acid added to each one of the formulations to ensure the conversion to nitric oxide rather than any sort of other compounds. So we've taken the necessary steps to limit that. So nitrate safety. We're gonna talk about 6 really important points of why nitrates are very, very safe. So that was the negative graph that we've kind of heard in the last slide. So let's talk about the evidence for the safety of nitrates, and it's quite substantial. First of all, vegetarians have 4 times the amount of nitrate intake than people that eat a regular diet, and they have the lowest cancer rates, including GI cancers. So this is counterintuitive to all the data that you may have heard of, or that is sometimes being pushed as saying negative things about nitrates. 200 grams of spinach has about 20 times the nitrates of the limits set by the World Health Organization. And the World Health Organization often sets very stringent, very strict limits. And we are regularly taking well in excess of those limits in our diet, naturally occurring inorganic nitrates. The DASH diet, which has been shown to be positive for cardiovascular function, especially blood pressure, has a nitrate content of 550 times greater than the WHO, the World Health Organization limit as well. So this has been unequivocally shown to have a positive effect. And the growing body, as you saw, all those human and clinical trials, that growing body of evidence showing the beneficial effect of nitrates on human health and on physiological function. So this is a lot of positive evidence that's now building the case for the benefit and obviously the safety of nitrate supplementation. Specifically on Axioma, and this is also very important to remember, and especially when you're talking to customers and clients, all of our Axioma products, the whole Nox line has MPNs. It's been deemed by Health Canada to be safe. One thing, I know this whole process with MPNs has sometimes been frustrating for a lot of different people from all ends, and AOR has done its utmost to cooperate with this. And we think in general this whole thing is beneficial because it's in the safety interest of the public. And Health Canada, while they won't approve a very maybe beneficial substance that maybe has not in their opinion, not the tightest clinical data, what they definitely do is that they watch the safety data. So if it has an MPN from Health Canada, one thing you can definitely be assured of is its safety. And also, as I mentioned, all of Axioma products have specific ingredients, green tea extract and citric acid, which is actually specifically meant to ensure the conversion of nitrites in the GI tract to nitric oxide and preventing the conversion of any possible conversion of nitrates or nitrogen groups to nitrosamines. So these two are specific to Axioma, making it a very, very safe formulation. Okay, so let's talk about the benefits of specific benefits of the Axioma line. All of the products in the Axioma line are using this nitric oxide pathway, this NOx 321 pathway that we talked about just here in the background introduction. Each product is a synergistic product because we've coupled the benefits of nitric oxide and another very well-established natural health ingredient, nutrients. And so you'll have the coupled effects of the rapid effects of nitric oxide for whatever the clinical endpoint is, coupled with the synergistic effects of another well-known ingredient. So you're going to have a short-term and a more extended proven benefit from these ingredients. Nitric oxide is a very rapid process. So we saw within 2-3 hours, nitric oxide production is increased in the bloodstream, and this can have impact immediately and right away. So specifically the Axioma, some people may have questions about, okay, well, what's the difference between the food source, which is used in some studies like beetroot juice, and then using a more of a salt source like potassium nitrate. First of all, there's been studies using both of these sources as a source for nitrates, and they've both shown to have positive effects. So it's safe to say that whether you're getting the nitrates through a functional food like beet juice or spinach, or whether you're getting it through a formulation like we have in Axioma, you're going to be having the positive beneficial effects of the nitric oxide formation. So basically, what we've done is we've coupled specific ingredients to take advantage of this pathway that occurs under low oxygen environments, under a very specific pH, to have a very wide range and superior supports for a wide range of health conditions. So, without further ado, let's introduce the Nox line, the Nox family of products. We have 6 products. We're going to talk about each one of them individually. And my hope is that after we talk about each product, you have an understanding of now not only the science behind the nitrate portion of it, but now how to apply that in combination with the synergistic other ingredient that's in it, how to apply that to specific health pathologies, illnesses, or whatever. And as you can see by the names, the indications, the uses are pretty self-explanatory. But we're going to try to really help you understand them much more specifically so you can really help your clients much better. Okay, so let's talk about Cardionox first. So Cardionox contains potassium nitrates, along with, like I mentioned, green tea extract and citric acid, along with coenzyme Q10. So we're going to talk about coenzyme Q10, which is a well-established beneficial nutrient for cardiovascular function. But let's talk about the nitrate and the nitric oxide impact on cardiovascular health first. So first of all, as we know, the most well-known effect of nitric oxide is its positive impact on blood pressure and its ability to dilate blood vessels, improve blood flow, and thus improve blood pressure. It's been clinically shown to improve blood pressure by about 10 millimeters of mercury systolic and 8 millimeters of mercury diastolic. These are substantial benefits. These are the equivalent benefits to what you'd want to see with the best nutraceutical product. Coenzyme Q10 also has a benefit of about 10 millimeters of systolic blood pressure lowering, and also pharmacological benefits. They're in around the 10 millimeter mercury range as well of their impact. So typically when people have cardiovascular disease, they're not getting enough oxygen flow to the right areas of the body. So this product, and this nitric oxide 3-2-1 pathway takes advantage of that low oxygen conversion, that environment, to provide nitric oxide there. And it's not just about blood pressure. It's also nitric oxide benefits clot formation, as I mentioned, the stickiness of platelets. It also has antioxidant properties and reduces the oxidization of LDL cholesterol, which is the bad cholesterol. So it has a wide range of cardiovascular benefits. Here again, I just want to highlight this graph of showing that it's a it's a great graph because it shows the causal, it shows us the causal impact of after you take nitrates, and then the effect in the bloodstream, there's a direct effect on blood pressure. And so let's talk about coenzyme Q10. We're all familiar with coenzyme Q10, very beneficial for cardiovascular function, specifically on the function of the heart muscle. This specific formulation combines the synergy of these two products that, as the coenzyme Q10 starts to work over days and weeks, nitric oxide is having an immediate effect on and having a positive effect on your cardiovascular system. So what is this product? Who would it be beneficial for, and what is it beneficial for? So hypertension, angina, we've talked about this before. Post-stroke recovery. Anytime someone is after a stroke, they're usually treated with blood-thinning medication because they want to prevent another formation of a clot. And nitric oxide actually reduces the stickiness, as I mentioned, of blood vessels. So this can be used as a post-stroke treatment. So it would be beneficial for those recovering from stroke and those trying to prevent the onset of one. So even if they have family history of any sort of stroke or transient ischemic attacks, this would be beneficial for. General cardiovascular function. Coenzyme Q10 is an excellent cardio antioxidant and a nutrient. So this would be indicated for general cardiovascular health, prevention of any sort of pathologies that we just talked about, pulmonary hypertension, and also, as I mentioned, physical and exercise performance. Because coenzyme Q10 increases the function of the cardiac muscle, which is very key in exercise performance, it's also beneficial for those athletes that are trying to improve their endurance. They're trying to improve the function of their cardiovascular system. Nitric oxide, in its own right, has been shown to be beneficial on aerobic endurance and aerobic function, but also coenzyme Q10 would be beneficial. Okay, so let's move on and let's talk about Inflanox. Inflanox is the next product that uses curcumin. And we're all familiar with curcumin. AOR is an excellent line of new products of our new most bioavailable curcumin on our long vita extract that I'm sure you've all received information about and talked about with your reps. So we've coupled potassium nitrate, a source of nitric oxide, with curcumin to have an impact on inflammation in the body. So one of the things that I mentioned before is that nitric oxide has an impact on immune cells, has an impact on inflammatory processes, along with being an antioxidant. So one of the ways that nitric oxide benefits inflammation and healing in the body is that actually it's been shown to speed wound healing. And this is key, especially in those that have impaired healing of tissues and impaired healing of wounds, in the elderly, in diabetics, and those that don't get enough oxygen to the area that's needed for cells to repair themselves. So wound healing is associated with nitric oxide. Also, antioxidants that limit the damage of free radicals, which contribute to the inflammatory pathway. And also, nitric oxide plays a role in the inhibition of inflammatory pathways in the body. So like PGE2, leukotriene pathway, nitric oxide plays a role in modulating that pathway as well. And so I think everyone's kind of relatively familiar with the benefits of curcumin. It has a very, very potent and broad spectrum anti-inflammatory process on impact on the body. Curcumin has been shown to not only decrease inflammation, but also decrease pain. And obviously the impact in conditions like arthritis, inflammatory bowel disease would be very, very powerful. So this combination would be great for general anti-inflammatory action. So again, you want that rapid effect of the nitric oxide from the nitrates, potassium nitrate in Inflanox, and then the more sustained effect of curcumin. Curcumin also is beneficial not just for inflammation, cardiovascular disease, so this would be another great formula for cardiovascular protection, gastric protection, liver protection. Curcumin has been as a hepatoprotective herb shown to decrease the oxidation in the liver and protect the liver. And obviously, your inflammatory conditions, your inflammatory bowel diseases, your inflammatory arthritis. And of course, like Cardionox, when we exercise, there's quite a bit of free radicals that are formed and quite a bit of inflammation that's formed. And that's very beneficial to supplement with curcumin to benefit that. And it is indicated in general, our curcumin active would be great for that, or our curcumin 95. But now we're going to have the rapid action of the nitric oxide through the nitrates and the NOx pathway, specific to Inflanox. Okay, so let's move on to Immunox. Immunox, similarly to Inflanox, is capitalizing on the beneficial effects of nitric oxide and its impact on the immune system. Remember, inflammation is an immune process, so that's why inflammation and immune function are often very much intricately tied. In Immunox, we are using the research, the evidence for olive leaf extract for the benefits on the immune system. So let's talk about the benefits of nitric oxide on the immune system. And they're actually quite potent. Nitric oxide has a direct antimicrobial effect, specifically on H. pylori. So this is beneficial for gastric function. It's been shown in clinical studies that it's killed the H. pylori bacteria. It also has impact on pathogens causing not only ulcers in the GI tract, but also urinary tract infection. As I mentioned, nitrates are secreted or excreted, I should say, in the urine, and also bacteria in the urine. They use nitrates as a fuel source. So when you would go to a doctor, they would often test your urine for signs of nitrates in it or nitrites. And this is an indication of an infection. Now, when the urine is acidic or even made more acidic by something like vitamin C or cranberry, which is one of the functions and mechanisms of cranberry, they make the urine more acidic. Now, those nitrites, like in the NOx pathway, are converted under those low pH environments to nitric oxide, which actually have an antibacterial effect. So you can see how nitric oxide has an important role to play in the GI tract, in the urinary tract, and also has an important role to play in the immune system, helping our immune cells, our T helper cells, our beta cells, which are key players in our immune system to fight off infection. As I mentioned, inflammation and immune function are really related a lot to wound healing and the healing of tissues. So often in inflammation and tissues that need to be healed, there's impaired blood flow. So nitric oxide will not only impact specifically the processes like, let's say, T cells or the inflammation, the PGE2 pathway, it'll also increase the blood flow through the vasodilation of blood vessels to these areas. So it has a multi-layered effect, as you can see now. Nitric oxide, the benefits of impacting nitric oxide are not just very, very specific, but they have a broad range of effect that's going to impact a disease process from multiple paths. Okay, so olive leaf extract, there's a number of clinical trials showing its antibacterial and antiviral properties. It is shown to increase the number of immune cells, and generally that's a great indicator of increasing immune function and the ability for our bodies to fight off diseases. So this has been shown to have a benefit on H. pylori and gastric ulcer formation, but also on upper respiratory tract infections. And so your common colds, your flus. And so you can see the synergy that olive leaf extract and nitric oxide will have in the body. So what can this be used for? Your typical cold and flu, viral, bacterial, and fungal infections. That's the benefit of both nitric oxide and olive leaf extract. General immune support. It raises white blood cell levels. And of course, you're going to get the benefit of olive leaf in not just for immune function. We all are very familiar with the benefits of the Mediterranean diet and higher intakes of olive oil. And the benefits, the health benefits, are not just limited to the olive oil. It's limited to the whole plant. So olive leaf actually has a beneficial effect on oxidation of cholesterol and also on general cardiovascular function. So you're going to be getting the added benefit of cardiovascular function with using this Immunox formulation. Okay, so that's Immunox. Let's talk about Rejuvnox. Rejuvnox is a specific product where we've coupled the benefits of nitric oxide with ashwagandha or withania. Withania is a common, actually aerobic herb that has been shown to have a beneficial effect on a lot of hormone and our stress metabolism in the body. So how does nitric oxide impact stress metabolism and our ability to kind of compete with the daily wear and tear and the daily stresses? So basically, the first thing is that it improves blood flow. When we're stressed, our cells actually need to function at a high level. We're putting more demand on our stress because there's a number of hormonal factors that are secreted in the body, and we need more oxygen delivery to these tissues. And so, of course, nitric oxide allows better delivery of oxygen to the tissues. Stress in general, the hormones will actually cause a vasoconstriction or a narrowing of blood vessels. And this actually will be counteracted by the nitric oxide. And also, nitric oxide is depleted as we age. So the overall levels of nitric oxide and the ability to produce it, those systems don't remain efficient through our whole life as they were when we were younger. So as we age, especially after 40 or 50 years old, as with other processes in the body, nitric oxide levels dip and they decrease. So combining nitric oxide with a beneficial herb like ashwagandha, you can see that a number of different types of stresses, so we mentioned vascular stress, can be improved and benefited by using Rejuvnox. So vascular stress, so the vasoconstriction of blood vessels when we're under stress, oxidative stress. Ashwagandha has antioxidant properties, and obviously, as we mentioned, nitric oxide has antioxidant properties. Ashwagandha is in a class called adaptogenic herbs. And what that basically means is that these herbs are used to help the body adapt or help the stress metabolism of the body, specifically our adrenal glands. Now, withania is found in some of our other AOR formulations like OrthoAdapt. And this formula is specifically meant to boost our ability to deal with the stresses of everyday life. And the same would be for Rejuvnox. So immune stresses, metabolic stresses, nitric oxide has an impact on mitochondria. And when we're stressed, our mitochondria, our cell machinery to produce energy, is not functioning optimally. So nitric oxide has a positive impact on that. And lastly, hormonal stresses. This is really where ashwagandha shines. Ashwagandha has a beneficial effect on both adrenal and on thyroid hormone production and use. So you can see now we're coupling Rejuvnox. In Rejuvnox, we're coupling nitric oxide with the benefits of ashwagandha. Like I mentioned, natural adaptogen. It's been shown to improve the body's ability to deal with stress and kind of pulling it back from the edge of fatigue and exhaustion. And ashwagandha, interestingly enough, has been shown to increase nitric oxide levels in the body. So there's an added synergistic effect. So that's Rejuvnox. What is it beneficial for, and who can you recommend it for? Definitely, I put in the context of chronic stress, adrenal fatigue and exhaustion, anti-aging, and all those things that are associated with aging, immune supports. Maybe not as a direct immune support like in Immunox, where you want to combat something like an upper respiratory tract infection, like a cold, but more for the prevention and supporting the body's ability to fight off infection. Ashwagandha is an anti-inflammatory. We use it in some of our anti-inflammatory formulations. And physical and exercise performance. Again, as you can see, this recurring theme is occurring, where a lot of these products can be impacted to a wide range of health benefits, including exercise and general ability to perform, whether it's activities of daily living or whether it's running a race or a marathon. Okay. The next product, we have two more products to go through. So the next product is Osteonox, and this is one of the products that has more of a specific indication. As you know, AOR is very proud of its bone formulations, and one of the bone formulations in advanced bone protection is called milk basic protein. And we've coupled this with potassium nitrate to support bone health. Now, bone health is a complex process, but actually nitric oxide plays a role in that as well. Those users, for example, of nitroglycerin, a patch that's been used to decrease the symptoms of angina, have found that they've had a higher rate of bone mineral density after using that source of nitric oxide. Nitric oxide, that's why it's been shown to improve bone mineral density. It also is a key signaling molecule. And as you know, in bone remodeling and reformation, there's a number of signals going on within that environment. And nitric oxide is one of those stimulatory signals that is essential in bone formation, in bone cell formation, and also in the formation of blood cells that are actually formed within the marrow of the bone. So nitric oxide is very essential for bone formation. And couple that with milk basic protein, which is just 40 milligrams, which is shown to have an improved bone mineral density after only 6 months, which is actually very short in terms of bone health terms. It's been shown to increase the activity of osteoblasts, where your bone building cells, and decrease the activity of osteoclasts, which is the cells that actually break down bone in the bone remodeling cycle. So there's clinical evidence for milk basic protein to improve bone mineral density. So we've coupled this to improve, obviously, osteoporosis, osteopenia, and improve fracture healing, any sort of cyst formation on bone, and generally even prevention of these things it would be very beneficial for. So you can see the synergy that is present in each one of the Axioma products. And this Osteonox specifically can be added to the list of our already very robust bone health formulations. Okay, the last product is Antioxidant Nox. Antioxidant Nox contains quercetin as a very potent antioxidant. So Antioxidant Nox is one of those formulations that probably has a more general benefit, even though there's some very specific things we'll discuss. Nitric oxide is a general antioxidant in the body. So as I mentioned before, it prevents lipids, so LDL peroxidation, which is very beneficial for cardiovascular function. It actually plays a role in stopping the process of free radical formation. So it acts against both oxygen and other nitrogen radicals. So that prevents damage to DNA, and preventing damage to DNA actually prevents the formation of things like inappropriate cells like you find in cancer. So quercetin. Quercetin is another very well-known nutrient that's present in a lot of fruits and vegetables as well, but predominantly fruits. Quercetin is a powerful antioxidant in its own right, given at the appropriate doses, like in Antioxidant Nox, 500 milligrams per dosage per day. There's also, as you can see, the general benefits of Antioxidant Nox is wide. So this would be the product that I recommend if someone's looking to capitalize on the benefit of nitric oxide, increasing that production, but they don't really have any specific pathology they want to impact. This would be a great one for general health maintenance. Now, a specific application, and this really pertains to allergies, is that quercetin has been shown to be beneficial for stabilizing mast cells and the secretion of histamine, which has been shown to be a key process in allergies. So quercetin on its own is beneficial for allergies. In this formulation, would be even better because nitric oxide, as obviously as we've established, has a key role on immune function, has a key role on the inflammation process, and it's an antimicrobial. So there's been studies in cystic fibrosis patients where they have a chronic infection chronic presence of these microbes and eliminating the danger of these. This is also one that I would kind of suggest for mitochondrial dysfunction. There's a lot of key interplay between nitric oxide and our mitochondria, as I mentioned. Quercetin, as an antioxidant, also has a key role on making sure that our processes, our energy production processes are optimized. They're functioning at the maximal level. And our mitochondria are those energy factories in our cells that are ensuring this is occurring. So if I'm looking for a mitochondrial benefit, if I'm looking for a superior antioxidant benefit, such as diabetes, this would be an excellent product for cardiovascular health, diabetes, and general health maintenance. Okay, so let's quickly summarize. That really brings us to the end of all of our material that we're talking about, our new Nox line, our Axioma line. But I kind of want to summarize the key points for each one of the products, just so we have a review. So Cardionox, heart health, blood pressure relief. There's little or no tolerance effects, and there's excellent clinical evidence supporting the benefits, specifically on blood pressure, but not just on blood pressure. Inflanox, combined with curcumin, excellent anti-inflammatory and modulation, and so the decrease of pain. Immunox. Immunox uses the benefit of nitric oxide combined with olive leaf extract to have a more of an acute effect of treating and also preventing infections. Rejuvnox. Rejuvnox is the product that works very, very quickly, because withania also works quickly for stimulating our body to adapt to stress, adapt to the toils of daily life, and to support our adrenal glands and our stress metabolism. And also it has another wide-ranging anti-inflammatory effects as well. Osteonox, bone health, osteoporosis, osteopenia, especially when other supplements are not working, in conjunction with your calcium and vitamin D. So this is another product to add to milk, to our milk basic proteins, to our advanced bone protection and our strontium support too. And Antioxidant Nox, a quick-acting, very comprehensive formula preventing the oxidation of a number of free radicals in the body. Pathologies like diabetes, where you really need to prevent the oxidization of substances like glucose in the body so the damages don't occur. So last thing I want to leave you with a few considerations and cautions just to understand potassium nitrate, because I'm sure a lot of the questions will not just be about how effective Axioma products are, but about how safe they are. And we will continue to answer all these through our reps and through our tech supports, but also we'll try to answer as much here. So first of all, potassium nitrates. There's no tolerance effects that have been shown in clinical trials using inorganic nitrates. One thing I would say is that if a person's already has low blood pressure or they're on blood pressure medications, that is when maybe using caution, asking them to consider talking to their healthcare provider if Axioma is the right product for them. Also, those that are on potassium-sparing diuretics or digoxin, and these specific two cardiovascular medications, they actually maintain and increase the amount of potassium that's in our bodies. And potassium being a very beneficial thing, we don't want to get it to too high levels because it can start impacting on conduction in the heart. Now, there's a very small amount of potassium. The majority is nitrate in Axioma products, but it's still very prudent to understand this. Other than that, nitrates in general have a very excellent safety profile, and coupling them with the products and the nutrients that we have added to the benefit aspect of things, and all the products are also very, very safe. And the last thing I wanted to mention, and most interestingly enough, is that one thing that I would recommend is that, it may seem odd at first, but recommending clients and customers and patients not to use mouthwash within the first 3 hours. If you remember back to that cycle, that pathway of nitrate to nitrite to nitric oxide, that pathway is dependent on bacteria in the mouth, in our GI tract, in our oral cavity, to convert nitrates to nitrites. And there's been studies that have shown that if you take mouthwash or you take an antibacterial in your mouth while taking a source of nitrates, it actually stops the beneficial effect. And it's because the antimicrobial will kill those bacteria in the mouth. So this is just an interesting, little point to remember, to point out to customers that this process, this natural symbiotic process in our body, is essential in the pathway, in this NOx pathway. So we don't want to do anything that's going to upset or disturb that or compromise the impact of that. And lastly, before we kind of wrap up, obviously Axioma has 6 products right now, but there's a wide range of benefits that you can see from nitric oxide. And it's feasible to foresee in the future that, seeing how things go and as studies come out, that there could be more products that could be added to the Axioma line to capitalize really on this really powerful NOx 321 pathway that has been shown to be an adjunct or another pathway of forming nitric oxide other than the L-arginine pathway. Now, could you use L-arginine and nitric oxide together? Sure you could, because it's actually using a different pathway under different environmental conditions for a benefit. So there could be products specifically for gastrointestinal health. There could be products specifically for skin health, because nitric oxide has been shown to be beneficial for that. So that brings me to the end of the official formal part of the webinar. Please and ask any questions. Dr. George Templeton standing by, and we will stand by just a little bit to answer questions. We'd like to say we're very, very happy that you participated in this webinar. We feel it's very important to have that educational piece as part of the Axioma line, because it's a very innovative and it's a very novel idea. AOR and our team here at AOR is extremely excited about Axioma, and we are really looking forward to seeing the beneficial effects of applying these 6 products and any other products that will come out in the future to have positive impacts on clients, customers, and patients, and really ultimately revolutionizing the way the people impact their health, from cardiovascular disease to bone health to immune function. So again, thank you for coming. If you have any other questions, please don't hesitate to ask now or through our technical support path at tech@aor.ca. And also, this Advances catalog or magazine is available online for free, and it's been sent. It should have been sent to all the accounts. It has in writing pretty much everything we talked about in this webinar. It is a great resource for both patients, associates, employees, and yourselves. So again, thank you very much. And at this point, I'm going to pass it over to Susan Warbell for closing remarks.
Thank you very much, Dr. Hrkal, for this great presentation. And to reiterate to everyone our thanks for taking time out of your busy schedules to attend today's webinar. We will be standing by for the next 5 to 10 minutes, so if you do have any questions, please don't hesitate to ask them in the Q&A panel. Otherwise, as Dr. Hrkal mentioned, email tech@aor.ca, that's TECH@aor.ca.